Good morning, everyone. My name is Bisi Ademoyiwa, and I am a breast medical oncologist. I work in a large academic institution in the Midwest, in the United States, St. Louis to be precise. And my role outside of the home is to take care of women and men who have been diagnosed with breast cancer. I also do a fair amount of education, teaching the next generation of physicians, so medical students, residents, fellows, and junior faculty. I participate in a lot of research, particularly clinical trials, as well as research related to understanding and improving disparities and inequities in breast cancer. And I also do some administrative work as well. Well, this video today is to discuss cancer screening, and I'm going to be talking about the big four. So specifically, those include breast cancer, colorectal, lung, as well as prostate. And those four cancers represent about 40 to 50% of all cancers that are diagnosed worldwide. Thankfully, all four of them have screening tests. So what is a screening test? Screening refers to a test or an examination that is used to find a disease in a person who does not have any symptoms. The reason to screen for cancers is to detect them early, and we know that early detection saves lives, because if you detect cancer at an early stage, it ends up being much more treatable as well as curable. So diving right into breast cancer, we have mammograms, which are tried and true tests that are used to detect breast cancer when it's very early and again most curable. The guidelines for screening include obtaining a mammogram once a year for all women starting at the age of 45. The American Cancer Society has a caveat that a woman who is 40 to 44 has the option to start screening once a year. Women who are 45 to 54 should get yearly mammograms. Women who are 55 and older have the option to continue yearly mammograms or switch to every other year. In general, here at my institution, we recommend mammograms for all women once a year starting at the age of 40, particularly for Black women, because we know that Black women tend to be diagnosed at a younger age and end up having more aggressive forms of breast cancer that are more lethal than the others. What do you expect when you go in for a mammogram? Well, a mammogram basically is a low-dose X-ray of the breast. You would have to undress, of course, take off your, underwear, and there will be a big machine that has two plates where the breast is placed within those, between those plates and flattened to get a very good look. That will be on the left side as well as the right side, and the images would be sent to a breast radiologist who would look through the images and make sure everything looks fine. The test itself takes about 10 to 12 minutes. It is not painful, but can be uncomfortable. Next is prostate cancer. So a discussion about screening should start to take place for every man over the age of 50, so 50 and above. For men who are 45 years old and at a high risk of prostate cancer, and this will include all Black men as well as all men who have a first-degree relative who has developed prostate cancer at a young age, so generally under the age of 65, screening should take place as well. And then for men who are 40 years old and older who are at even higher risk, so this will include, again, African American men, other Black men, as well as those individuals who have a family history of at least two close relatives who have developed prostate cancer at a very early age. And again, that would be about 65 and under. In general, to make things very simple, we would recommend men 40 years and older getting prostate cancer screening, which would be in the form of a blood test called a PSA. and this is very sensitive for detecting prostate cancer. So there are specific numbers that we look at on the PSA test. If the PSA is 2.5 and above, we recommend it to be done once a year. If the PSA is below 2.5, then the test can be done every other year. And again, highly accurate in detecting prostate cancer. And again, if prostate cancer is detected early, it is highly curable with different modalities. Men have the option of having surgery to remove the prostate, or radiation, which can be given and is essentially as effective as surgery as well. How about colorectal cancer? So colorectal cancer is a cancer that starts in either the colon or the rectum, so the bowel. So there are two types of tests that we recommend for colorectal cancer screening. The first, which is more accurate and more of the gold standard, is a visual examination of the colon by way of a colonoscopy. This test is recommended to be done once every 10 years in the average risk person. So this involves doing preparation for the test, drinking laxatives to wash out all the stool and debris from the colon, so that whoever is performing this test gets a very good look. The nice thing about colonoscopy is that if there is an abnormality that is seen, the surgeon or gastroenterologist who is performing the colonoscopy can actually remove that with a biopsy, or with any other form of a small surgical incision to take out a polyp, or if anything looks abnormal, they can biopsy it right there and then. The downside of this test is that it needs anesthesia, and then of course it's an invasive test. You have to go under, you have to take some time off, and then the prep to undergo the colonoscopy can be sometimes a little bit unpleasant. The other form of testing is stool-based test, and we have three of them. One is the FIT, so the fecal immunochemical test, which looks at blood in the colon. There is also the fecal occult blood test, so FOBT, again looking at blood in the colon, and then there's a stool DNA test. The FIT and FOBT need to be repeated once a year, and the stool DNA test is repeated once every 3 years. And again, these are options for people who don't have access or don't want to undergo the more accurate colonoscopies. So lastly, I want to touch real quickly on lung cancer. Again, we've started screening patients for lung cancer, and these are patients who are at a high risk of developing lung cancer. Patients or individuals who are between the age of 50 and 80 years old and who have had at least a 20-pack year smoking history. What is a 20-pack year smoking history? Well, 1 pack year is equal to smoking 1 pack, which is 20 sticks of cigarettes for 1 year. So 20 packs, a 20-pack year would be doing that for 20 years. The other way to reach 20-pack year would be to smoke, for example, 2 packs for 10 years. That will get you to a 20-pack year. So if you are between 50 and 80 years old and you have at least 20-pack year smoking history, a low dose CT, a CAT scan for lung cancer screening is recommended for you. And again, this is repeated once a year, depending on the results. If an abnormality is found, then usually we would recommend more testing, which would come in the form of biopsy, so a needle biopsy to actually stick into that abnormality, sent to the pathologist who would look under the microscope and determine if that abnormality represents cancer. So if you have an abnormal screening test, depending on what it is, so if it's an abnormal mammogram, more testing would usually be done, and more testing will involve perhaps an ultrasound or an MRI, or if the index of suspicion is quite high based on the mammogram, then one would probably be recommended to have a needle biopsy. For lung cancer also, if the index of suspicion is high and the abnormality is a certain size, one would be recommended to have a biopsy. Same thing for prostate cancer as well as colorectal cancer. Now, I do want to encourage you that screening is exceedingly important, very, very important for detecting cancers when they're early and most curable. And if you have an abnormality on a screening test, it does not necessarily mean that you have cancer. More testing is usually recommended to clarify that. So thank you for listening. Please get your screening test. Talk to your husbands if you're a woman about screening for prostate cancer. Talk to your wives and your loved ones, females in your family, about screening for breast cancer. If you know a smoker, or if you have been a smoker, consider screening for lung cancer, and of course stopping smoking, because that does a lot of harm and causes a lot of other medical problems. And then if you're at high risk of prostate cancer, or over the age of a certain age that I mentioned, consider getting your PSA test to screen for prostate cancer. Well, thank you for listening, and please reach out with any questions. Again, my name is Bisi Ademoyiwa, and it's been a pleasure talking to you today. Thank you.